Well, with the surge in cases and overflowing hospital rooms, nursing schools just can't graduate enough students right now to meet the need out there. Tarleton State University's nursing degree program, by the way, is one of the top ranked in the country. And joining us this afternoon is Dr. James L. Hurley, the president of Tarleton State University, to talk more about this. Thanks for being with us today.
Yeah, Happy New Year, Jason. Thanks for the invitation.
Happy New Year to you as well. I know you all have been busy there. Give us an idea of what it's like in the nursing program right now. Have things changed significantly since we entered the pandemic?
It really has from a training standpoint. Think about how hard it is to teach some of those programs online, right? Nursing is one of the few programs, especially in the RN to BSN transition, that you want that hands-on experience and you want those students to learn from actual patients versus simulation. We've had a shift a lot to simulation labs. Of course, a lot of the clinical rotations that we depended on to train and to teach our nurses, those were diminished because of COVID-19. So our College of Health Science, Dean Sally Lewis and her team, they did a remarkable job of getting our students placed and preparing as quickly as possible.
I'm amazed at the calling that so many people have to go into this profession. We have seen how hard this has been on nurses over these past months, nurses and doctors. What are you all seeing as far as demand goes with people wanting to sign up and get into the program?
Yeah, I concur. You really think about those frontline workers, and we're so blessed here at Tarleton. We saw extreme growth, not only in our student overall population, but we have more and more young people, male and female, that are seeking a nursing degree. And so we're investing more into the nursing program. We just had our third largest cash gift in the history of the institution to help support scholarships specifically for nursing students. And we're launching two new programs. Well, one new program, and it's really off the back of TCC, but we're also now partnering with Dallas Community College to offer a co-curricular RN to BSN program right there in the Metroplex, where a cohort of 30 and 30 each year for a total of 60 new nurses at both TCC and DCC to help try to meet the needs. And that's just a very small number of the needs that our hospitals have for nursing practitioners.
That is awesome news. Congratulations on the big gift for the university there to sort of expand what you all are trying to do as far as getting these graduates out there and into hospitals where they are needed. I asked you about the demand for people seeking these degrees. Let's talk about on the other side of it. Or have you been hearing from a lot of these healthcare facilities and hospitals just saying, you know, how many more can you send us? When do you have a new crop that's going to be graduating?
Yeah, almost daily I get a text from a hospital CEO, CFO, COO. I know Dean Lewis's phone rings off the hook with hospital administrators, and we really are. Our focus here, we've said from even pre-pandemic, we were really focused on meeting the healthcare needs in our rural region that we serve, because we've seen just such a huge need for rural practitioners, not only in nursing, but you and I have talked about it before, physician's assistants, physical therapists, occupational therapists, all of the other allied health needs. We're really focused on meeting those needs over the course of the next year to 2 to 3 years. And so, yes, we're hearing constantly, almost daily, from hospital administrators. We're producing these nurses as fast as we can. We produce around 200 graduates per year that leave Tarleton with that BSN degree. And so we're hoping that we can double those efforts over the next 3 to 5 years.
Wow, that's phenomenal. Dr. James L. Hurley, the president of Tarleton State University, a big thanks to your staff there and all of your students for choosing this calling, which is really helping all of us out at such a tough time. Really appreciate your time today.
Thank you.